welcome to another video series this Friday where what we're going to be talking about is addressing the cost of fertility care. Huge subject for patients, and there's good reasons for it. You know, a lot of the patients that we see, they have insurance coverage, some of them don't have insurance coverage. They might both need the same treatment. It's a way of figuring out how do we get the right treatment for those patients. So addressing the cost of care is critically important. Now, a lot of the treatments that we perform in fertility, such as in vitro fertilization as an example, require experienced and skilled providers. Okay, not just clinicians, which is the people that see you in the clinic and help you, but also the people behind the scenes, such as embryologists, andrologists. A lot of them are trained at the PhD level. So that's a long training process. A lot of them have had to undergo extensive training in embryology to be able to manipulate eggs and sperm and embryos, and you want that. But unfortunately, there's a cost to it. The other expense that's involved is the equipment that's used. There's a lot of very high-tech equipment that we use in the laboratory to be able to provide the services we provide. And those costs, unfortunately, have to get transferred on to patients. So that's where all the costs come from when you talk about why is it so expensive to get some of these treatments done? Well, there's ways of trying to get those costs taken care of. Now, what would be ideal is everybody had insurance coverage that covered the cost of their treatment. Then it would be a very easy decision on what to do because you just decide what's the medically right thing to do, let's do it. But when you have to address the cost, then it makes the patients think twice on whether they would want to pursue a particular treatment or not, because that cost may be cost prohibitive for them. Because of that, we have full-time financial counselors in our office, like most offices do that provide fertility services. The role of those counselors is to try to find a way to make that service available to you so that you can get the treatment you need and get pregnant. That's our ultimate goal for you. So the counselors will help us to get there. Now, there's all kinds of options that they go over with you. There's different package programs where you can buy multiple cycles and get a reduced rate. You can buy refund programs where you might pay more up front, but if you don't end up with a baby, then you end up with a significant portion of your money back. Now, in patients who have infertility insurance coverage, then the counselors go through what those benefits are, what would be the out-of-pocket expense for them, co-pays, deductibles, all the details and the nitty-gritty behind how to get that treatment covered so you get the treatment that you need and we can help you get the baby that you deserve. Thank you.